I'm about to call up to the front row the next group of people. So if you're not in this list or in the first group that I called, I really do ask if you find another seat, because this is all designed to keep people moving through.
I didn't know to sit here, by the way. Your secretary.
Okay. So we have
Sylvia.
Sylvia.
You see
Yeah,
why
that
I
was a
flunk
good one.
handwriting.
We have subsequently figured out it's Sidney. But before we get into that, I would like to call into the committee room in the first row Susan Mahan, Scott Porter, Colin Aponte, Jessica Creedon. I think that is. Brian Shemp. Please.
Okay. Thank you for having me. My name is Dr. Sidney Seawall. I'm from Hollowell. I'm a pediatrician practicing in this community for over 30 years. I've had the honor of taking care of legislators' children, and I've actually had some patients that have become legislators. And I empathize with you for having to deal with this very contentious decision. But I want to also state that the safety and efficacy of vaccines should not be the issue that's being debated. The science clearly supports public health. You can see from my chart on the written submission that's been passed around, if you have your reading glasses at least, how vaccines have reduced the burden of disease in the population over the last century. Yes, sure, whooping cough is still around, but remember that in 1900, if you were a kid born in the United States, you had a 1 in 200 chance of dying of whooping cough by the time you were a year of age. The germs are still out there. When the Soviet Union and its healthcare system crumbled in the 1990s, there were actually outbreaks of diphtheria in Russia. You just heard about a case of tetanus in Oregon. Measles is only an airplane ride away. Now, kids get vaccines early in their life because that's when they need them for protection. But this is also the age when underlying conditions that have previously been silent begin to appear. Unfortunately, because of this temporal association, vaccines are blamed for various disorders based on a variety of mechanisms that have not been supported by scientific scrutiny. The handout that's attached to my written testimony goes through a number of those. I personally have seen countless reactions to vaccines. Sore arms and legs, fainting spells with kids hitting their head, rashes, high fevers, and even febrile seizures. In 1-year-olds, for example, getting an MMR vaccine has about a 1 in 3,000 expected chance of leading to a febrile seizure. I personally, however, have never seen a patient of mine who, after getting a shot, had a long-term sequelae. Now, while febrile seizures are frightening, they are benign. The complex causality that goes along with some of the alleged complications, however, needs to be elucidated a little bit. There are some rare situations when a child has a febrile seizure, either from a virus or a vaccine, goes on to have non-febrile seizures, and goes on to have significant developmental handicaps. If this happens after a vaccine, it seems very obvious that the vaccine is the culprit, but that's not always the case. When Dutch investigators a few years ago studied the population of kids in their country that had this rare outcome with newfound technology, they found that 2/3 of these kids had a previously unknown class of genetic sodium channel disorders that would have eventually had this, and these kids would have eventually had the same outcome whether or not they had the vaccine. The fever caused by the vaccine unmasked the condition, but the vaccine did not cause the problem. It's often stated that pro-vaccine groups that I'm a part of are victims of their own success because the diseases are gone. It's kind of ironic that the anti-vaccine groups are also victims of their success, now that their numbers threaten population immunity. The difference is that the vaccine support is backed up by peer-reviewed and reproducible science, while the opponent's position, in my opinion, is fueled by myths and conspiracy theories. As other speakers will testify, there's solid legal precedents for policies that ensure school safety. And thank you for your attention. I'd be happy to answer any questions.
Thank you. Are there any questions? Thank you very much.
Okay.
Patricia Ansley.
Good afternoon, Senator Millett, Representative Cornfield, and members of the Education Committee. My name is Pat Ansley. I'm a registered nurse, and I live in Lebanon, Maine. And I come here today, and I'm representing the Maine Association of School Nurses. And I'm also the school nurse at Wells High School. It's the position of the National Association of School Nurses that immunizations are essential to primary prevention of disease from infancy through adulthood. Promotion of immunizations by registered professional school nurse is central to the public health focus of school nursing practice. The National Association and the Maine Association of School Nurses support the Advisory Committee on Immunization Practices vaccine recommendations that are adopted by the CDC. After careful consultation with school nurse and education leaders in the states that have removed religious and philosophical exemptions, MASN believes that this is evidence-based practice is in the best interests of Maine students. According to the CDC, the impact of vaccines in reducing and eliminating the vaccine-preventable diseases has been one of the 10 greatest public health achievements in the U.S. The CDC estimates that vaccination of children born between 1994 and 2013 will prevent 322 million illnesses, help avoid 732,000 deaths, and save nearly $1.4 trillion in total societal costs. Despite the medical and public health advances brought forth through vaccination programs, the immunization rates in some Maine schools are alarmingly low due to the philosophical and religious exemptions that are currently allowed. The problem will not be solved without clearly defined medical exemption guidance that supports healthcare providers yet maintains their practice autonomy. In addition to the primary care provider, school nurses are often sought out by parents for immunization advice. We educate students, families, and school staff about the critical role vaccines play in preventing disease, allowing students and staff to remain healthy and in school. According to NASN, school nurses need strong vaccine recommendations and medical exemption guidelines to provide families and staff information about preventable diseases, vaccine myths, vaccine safety, and recommended schedules. School nurses also help parents by discussing vaccine hesitancy and support decisions using the most current scholarly information. It's necessary that school nurses and primary care providers alike rely on the latest evidence provided by agencies such as the Maine CDC and Maine Department of Health and Human Services. MASN is in favor of eliminating the philosophical and religious exemptions, but agree that legitimate medical exemptions are necessary. As a school nurse for almost 17 years, I have seen appropriate use as well as misuse of the philosophical exemption and suspect this may become the case with the medical exemption if Maine does not have strong immunization law. MASN certainly does not wish to interfere with the provider-patient relationship, nor do we want to limit provider autonomy. True medical exemptions are in fact very rare but must be available. We also want to keep the DOE and DHHS as a voice in the rules. We are a diverse state, and some of the needs, say in Portland with a high immigrant population, those communities may need protection against hepatitis A, which currently is not required for school entrance. So I ask you to please consider these reasons and vote in favor of LD 798. Thank you, and I'm happy to answer any questions.
Thank you very much. Are there any questions? Thanks for your testimony.
Thank you very much.
Okay, I'm going to read the names again because I think we're missing some people. Susan Meehan, Scott Porter, Colin Aponte, Jessica Creedon, and Brian Schimpf should be in the front row. We do that so we can keep the testimony going. We've been joined by a legislator. Are you a co-sponsor?
No, I'm not.
Okay.
I'm in opposition.
Okay, all right. So you're welcome to join. Just so you know, we have been using the clock on legislators that are not co-sponsors.
I don't blame you.
Please feel free to come up.
Thank you very much. I have no written testimony, and I have not signed up yet, but
You'll
I will-
provide something for us at some point, hopefully.
okay, thank you. I'm here to, by the way, I'm Representative Jeff Hanley, District 87, where I represent the towns of Alna, Pittston, Wiscasset, and Randolph. I'm here to testify in opposition
To
to
We were running two bills at the same
Yeah,
time, LD 798
yeah.
or
And
987.
in neither support or against of 987,
Okay,
but opposed to 798.
okay.
And primarily, the reason I am against this is I'm not against vaccines, but I am speaking for the natural right of a mother and father to make decisions about their child. And when you start giving your rights away to government, that's a slippery slope, and you want to be very, very careful of it. And it is a natural right that a mother and a father have the right to raise a child, to educate a child, to care for the child. The state can only step into that circumstance if there's overwhelming evidence of neglect or abuse. I vaccinated my children. I would vaccinate children today, but I would do it very specifically. I'd be very careful. I would be sure and investigate which vaccines, at what concentration, but that's my decision, not the state's. And that's what I want to really emphasize here, that I'm not against vaccines. I think they're fine. They do their job. But every parent has a right to choose when and where at what level. And this truly is about freedom. I don't know, I'm sorry I've missed a lot of testimony. I was at another hearing. But I don't know if the problem of, I know I listened to Senator Foley's story about losing his baby daughter. But in my family, the issue of autism has come up, and vaccines tied to it very closely. I know a lot of people don't believe there's a correlation, but I have testimony I could present some other time, but not today, but that there is a correlation between the introduction of certain types of vaccines in the past 30 years and the increase in autism, and the very obvious numbers. So if I was a parent today, I would be extremely cautious about vaccinating. I also, and in finishing, I find it very strange that in a society that insists that a woman can choose to abort her baby or give birth to it, would somehow think that it's possible to forbid that same woman from vaccinating her child or forcing her to vaccinate that child. It's a sign of schizophrenia, social schizophrenia. Make up your mind. Either you have a right or you don't. So that is the end of my testimony. You've listened to a lot, and you're going to listen to a lot more. Thank you very much. I'll answer any questions if I can.
Thank you, Representative. Are there any questions? Thank you for coming.
Thank you very much.
Okay, Susan Meehan?
Thank you. Hi, I'm Susan Meehan from Augusta, Maine, and I'm here to testify in opposition to LD 798 and in support of LD 987, which I can summarize that simple support, and it's between patient and doctor. But Senator Millett, Representative Cornfield, and members of the Education and Cultural Affairs Committee, there are moments in life that make us who we are, defining moments often shared by family. In our family, one of those defining moments is the day that Cindy May was vaccinated. Unfortunately, June 20th, 2003 is one of those monumental days in our family history, one of those markers. On June 21st, 2003, 10-month-old Cindy Mae Meehan had her first epileptic seizures, 27 hours post-vaccination with her third set of Hib, Prevnar, and DTaP. Diagnosed with vaccine-induced encephalitis, for the next nearly 13 years, Cindy Mae battled seizures, often uncontrolled by pharmaceutical medications. The daycare Cindy Mae was attending in 2003 would not accept our philosophical or religious exemption, and a law just like LD 798 did in fact result in Cindy Mae's death. Until June 21st, 2003, Cindy Mae did not qualify for a medical exemption, even though her parents had reservations. Every time government or laws were in our way, Cindy Mae suffered. In 2012, after 90 days seizure-free on medical marijuana in an illegal state, Cindy Mae and her mom very hurriedly rushed for the refuge of Maine's legal medical marijuana state. This very committee in 2015 unanimously forwarded a legislative document that became law to give Cindy Mae access to to free and public education, a law that allowed her to return to school with her marijuana-based medication by her side. A different story, but Cindy May was part of a bigger picture of family, a society, a village, and a tribe who loved her. When Cindy May's doctor told me that those vaccines would do no harm, in fact guaranteed, he was wrong. Yet he had more knowledge of Cindy May than any of you have of any of the children who would be affected by this bill. What I would like this committee to consider today is an ought not to pass on LD 798, not to legislate and mandate medical choices, injection of biologic agents, and other medical procedures. To mandate that all patients fit into one criteria, why do we need real doctors who see real patients? Will this be the day that our government was authorized to decide what vaccinations pharmaceutical companies could sell at great profit and potential harm to children? Or will it be the day that Maine listened to their constituents and reaffirmed their constitutional rights? Our fourth perfect baby girl went into that doctor's office, and the damage caused by those vaccinations was irreparable. You cannot ever take that needle back. Where there is risk, there must be choice. Choice of medicine, medical procedures, and injections. I vehemently oppose LD 798, not only for my children, but for yours, our future generations, and in Cindy May's honor and memory. Most, if not all of you, can only imagine how hard it is for me to be here today. Here, instead of by my daughter's graveside, on the 3rd anniversary of her death. 3 years ago today, on March 13th, 2016, Cindy May Martha Mahan of Augusta, Maine, took her last breath while sleeping in her daddy's arms. Cindy May died from epilepsy directly caused by vaccine-induced encephalitis. I am here to say that the risks of vaccines can be tragically high, and her personal choice must be maintained. Where there is risk, there must be choice. I thank you for your time. I'm happy to answer any questions.
Thank you for your testimony. Are there any questions? Senator Pouliot.
I don't have a question, but as your state senator, I just want to say thank you for coming here today, especially on what I'm sure is such a difficult day. And in Cindy May's memory, thank you for your testimony.
Thank you.
Thank you.
My name is Scott Porter, Superintendent of Schools in AOS 96, 11 towns in the Machias area, and I am offering testimony in opposition to LD 798. Senator Millett, Representative Cornfield, and other distinguished members of the Education and Cultural Affairs Committee. Again, my name is Scott Porter, Superintendent of Schools in the Machias area. I'm responsible for 8 schools with a population of 1,000 students. It is my job to ensure that all students in the towns I serve have access to a high-quality education that complies with all state and federal laws. All students, as you know, in Maine currently have the right to come to our public schools to be educated. If this bill becomes law, there'll be students, even in my rural part of Maine, that will not be allowed to attend school next year, even though many of them have been attending school with their classmates for many years. This type of law will completely disrupt the education of thousands of students across our state. Families with limited resources that value the education their children are currently receiving will be required to remove their children from public schools and find alternatives for educating them. Many of these parents readily admit they do not have the skills or resources necessary to educate their children apart from the public school system. Who will educate them? These children will be at great risk if LD 798 becomes law. The current immunization law that is in place in our schools is working well. A high percentage of our students are immunized. In our area, it's about 97%, with a small percentage of students opting out due to medical, religious, or philosophical reasons. There are some families that have been able to obtain medical exemptions, but others have sincerely held religious or philosophical beliefs. Currently, the deeply held convictions of these children and their families are being honored by our great state, but LD 798 will change the tolerance that currently exists for differences in our belief systems. Keeping children out of public schools because of deeply held spiritual or philosophical beliefs is just wrong and flies in the face of the liberties our country is known for around the world. This type of law would discriminate against a population of children that deserve to be educated like all the other children in Maine. In closing, I do believe that parents, not the state, know what is best for their children. Parents should have the right to choose whether their children should be immunized or not. In some cases, children have been injured by immunizations, and therefore parents do not feel they can take the risk of injuring their children again. In addition, there are children who have deeply held religious or philosophical beliefs against being vaccinated. We teach our children every day to stand for what they believe. We should give every child that follows their convictions our approval and support, but this type of law would assess them the overwhelming penalty of losing access to an education. LD 798 sends a wrong message to our children and families. I ask this body of important decision makers to not support LD 798. I believe it is wrong for the children of Maine. Thank you.
Thank you. Mr. Porter, are you a member of the Maine School Superintendents Association?
I am part of that, correct.
And have they voted on this bill?
They have. I'm not representing them at this time. I'm just representing my district.
Okay.
Yep.
Do you happen to know how they voted?
As far as I know, I'm on the legislative committee. The Superintendent's Association, it was a difficult conversation.
That's what I just was wondering if you knew how they voted.
Yeah. My understanding, I was in the meeting, was that they support LD 798 with an amendment to keep the religious exemption.
Great, thank you.
Yeah.
Representative Sampson.
Thank you, Madam Chair. Nice to see you, Mr. Porter.
See you.
So my question, I know you come before our committee often, and you are a numbers man. If this bill were to pass, how will this financially impact your district if those students can't come to the school?
I mean, it has financial implications, there's no question, but, you know, and it would be hard to calculate that without taking a few hours, because I have minimum receivers, as you all know what those are, in some of the, with 5 of my 11 towns. Machias would have most of the students that would have this situation at hand. So, I mean, it certainly has financial implications. The bigger piece for me is these kids are not going to have access to a public education. And the thing that really is difficult for me to comprehend is that they won't be allowed to go to school, but yet they can come to after-school activities, and these kids are going to still interact. There is just no way to keep them apart. So how do you do that? Well, logically, I don't think it's possible. So these kids are still going to have time that they're exposed to each other, whether it's with basketball groups that are even outside of school, families. You even have some cases where a child may have been injured by a vaccination, and they have a sibling that was not. So you literally are going to have cases where some of these kids can go to school in the same family, and some that can't. So I can't see logically how it can possibly work when these kids are still going to interact somehow, somewhere, someplace, sometime. And I don't think we're going to be at the place where we have someone watching after-school activities to keep them from coming into those, because I don't think we're even allowed to do that. They can come.
Mr. Porter, we heard testimony earlier, legislator that has been tutoring a child that's forced to stay home because of the compromised immune system. Do you have a sense of how prevalent that is across the state?
I don't.
Okay. That would be a good question to have answered along with the other ones that have been raised earlier. Thank you very much.
Thank you.
We are up to Colin Aponte.
Good afternoon. My name is Colin Aponte. I'm 14 years old from the town of Blue Hill and a freshman at John Baptist High School in Bangor. I'm the concert master of the Bangor Symphony Youth Orchestra and a state record holder on the Ellsworth YMCA swim team. I have performed violin at the Collins Center and Cross Center and will represent Maine this summer at Carnegie Hall in the National Youth Orchestra of the United States. Last year, I was the first student in Maine to win both the Maine State Spelling Bee and the Maine State Geography Bee. I was invited here to Augusta and honored with a legislative sentiment. I was featured on Maine television and in all the local newspapers. I went on to proudly represent the state of Maine in Washington, D.C., and had my picture taken with Senator Collins. Last year, I was celebrated here as an outstanding student. This year, I feel more like an outcast and a pariah. You see, I'm one of the unvaccinated kids you now consider a danger to public health and unworthy of the right to a public education in Maine. If LD 798 passes, I will no longer be allowed to attend Babst High School or any high school in Maine. I'll be kicked out of school, even though I'm not sick and have no disease. I'll be kicked out of school, even though I'm a high honors student with a 99.85 GPA. I'll be kicked out of school, even though I'm a leading member of the Babst Chamber Orchestra and swim team. I'll be kicked out of school, even though I add much needed racial diversity to the classroom as a Hispanic. I'll be kicked out of school, even though teens who vape, take drugs, get drunk, and bully are often allowed to remain. I will be punished, shamed, and stigmatized because my parents dare to exercise their religious freedom to choose what I inject into my body. Given the devastating impact LD 798 will have on me, I have 4 questions for you. 1, why are you unfairly singling out unvaccinated kids? You must know that vaccinated kids carry and spread disease too. Will you kick them out of school if their immunity wanes or a blood titer shows they never developed immunity in the first place? 2, why are you unfairly singling out kids? Why aren't you requiring every single adult in Maine to follow the CDC vaccine schedule in order to protect public health? 3, what will happen to me? As an unvaccinated kid, will I be allowed out in public or quarantined at home? Will I be forced to wear a badge on my clothing or a tattoo on my arm to warn people to stay away from me? And 4, why can't the law remain as it is now? Right now, if someone contracts a disease at school, unvaccinated kids have to stay home until the threat passes. This seems like the perfect compromise. It allows me the right to a public education and keeps the spread of disease to a minimum. But LD 798 goes way too far. Under LD 798, I will have no educational future in Maine. Please do not pass this bill. Thank you for your time and attention.
Thank you. Are there any questions? Thank you for your testimony.
Thank you.
Before we proceed, I want to have come to the front row folks that are listed in support of LD 987. And I'm not sure if she's meant to testify on this before or after, but I'm going to we'll call her name again. Laura Blaisdell, Elizabeth Shardlow, Travis Grandin, Tony Bashinsky, and Daniel Grandin Stevens. So please come to our committee room and sit in the front row, please. And now we will hear from Jessica Creedon.
Senator Millett, Representative Cornfield, and distinguished members of the Education and Cultural Affairs Committee. My name is Jessica Creedon, and I live in Buxton. Thank you for allowing me to be here today and provide testimony. I'm the mother to 4 children. 3 of my children have disabilities. My youngest child has a rare genetic condition called CDKL5 deficiency disorder. She has severe epilepsy, she doesn't talk, has difficulty walking, and is severely cognitively impaired. Being forced to have her vaccinated in order to attend school would likely kill her. She does not qualify for a medical exemption in the state of Maine. I am a special education teacher, and my husband is a family nurse practitioner and has been a registered nurse at Maine Medical Center for over 21 years. Simply put, we are opposed to any effort that erodes our personal and human right to informed consent. Should this bill pass, my family has one option: to move. It would not be possible in any way for me to quit my teaching job to homeschool. 3 of our children have one-to-one staff. They require maximum support. I would not be able to give all of them the educational support they need to be homeschooled. Our children will be denied the right to a public education. I can tell you, children with special needs are already excluded in so many ways. The thought of denying them and excluding them from a public education is heartbreaking. You are asking for a one-size-fits-all approach. As a teacher and a mom, I can tell you there is no such thing as one-size-fits-all when it comes to children or medicine. Speaking as a special educator, I can tell you that most parents heavily rely on schools to help them decide what is educationally best for their child and what services are most appropriate for their child's needs. Many families are not equipped to do this on their own. Many of these children will not get the education, socialization, or related services they need if they're not allowed to attend school. This is very dangerous and will cause so much needless suffering. We're a two-income household. There have been times that my husband has had to work an additional nursing job to meet the financial needs of our family. Our children's medical bills and costs for their care, because they have disabilities, is outrageous and not attainable on one income. We do not have family or natural supports to help us in the care and education of our children. I'm 44 years old, and with the exception of 4 years of college in Missouri, I have lived in Maine my entire life. I returned to Maine after college because I realized that Maine truly is the way life should be. We would have to give all of this up, and would give it all up, to give our children the education that they deserve. Once again, I ask you to please give this serious thought and oppose LD 798. My children's health and education, a career that I absolutely love, and a town that I call home are all on the line. Thank you.
Are there any questions? Thank you very much.
Moving up in the world.
No, I can do it. Elizabeth Shadlow.
Good afternoon, Senator Millett, Representative Cornfield, and members of the committee. I have just one brief thing to say about LD 987, and I'll be presenting you with the data on 798. In addition to what has already been testified about, sorry, my name is Elizabeth Shardlow, I live in Kennebec County. There was a 2016 rule change, a very minor rule change that was made to the DHHS regulations around school exemptions, what qualified for medical exemption in Maine. And prior to that 2016 rule change, the medical exemption rate in Maine was 10 to 11% of all exemptions. After that rule change, that was reduced down by half to between 4.5% and 5.5% of exemptions. In the philosophical exemptions increased by that same percentage, indicating that there are children who had medical exemptions prior to that 2016 rule change who are now only covered by those philosophical exemptions. And I have the data for that, and I'll be presenting it later for LD 798, but I just, in the effort of time, wanted to be brief.
Thank you very much. Any questions?
Thank you for your time.
And I beg your pardon, I skipped you, Brian.
I wasn't sure that I was going to give my testimony. I was just
No,
come here
that was my fault. It was a change in guard here, and I
Well, I'm here to represent. My name is Brian Shemp. I live in Dixmont. I'm a homestead farmer and a small business owner, and I represent my wife, my children, and myself. And I'm here to oppose LD 798. I did not know that there was such a controversy. In our great state, the Maine Constitution declares in Article 1, the Declaration of Rights, which you guys are aware of, today is being brought forth to you to remove the parent's legal right to make a health care decision. In Section 1, titled The Natural Rights, all people are born equally free, independent, and have certain natural and unalienable rights, among which are those of enjoying and defending life, liberty, acquiring, possessing, and protecting property, and of pursuing, obtaining safety and happiness. What this bill does is to remove my right as a good parent. Earlier, you had a testimony that says we are ignorant parents. Our legal right of independence and the right of defending life under my parental care to enjoy that life and to live under the banner of liberty, it removes my right to have a choice. We choose to move to this state so that as good parents, active parents, engaged parents, responsible parents, loving parents, and yes, informed parents, we would be the ones responsible for and the ones that chose which direction and which course of method is acceptable and proper to take in providing the healthcare decisions of our own family. We wanted this versus the other options of having the authoritative, uninterested legislators that looks at people as a number of a sheet on a piece of paper, or even worse, dollar signs for big corporations. The hypocrisy has no limits. Legislators say that women have the right of pro-choice to take life when they want, not needed, but when it comes to pursuing life, to pursuing enjoyment in life, which is in our Constitution, to pursue healthcare informed decisions, not to put poison in one's body, they're saying we don't have that right. We are informed parents. We are very active in the mental, physical, and yes, maybe you don't want to hear it, but spiritual growth in our children. We are not some minority, modern-day, unconventional parents that allow a child to have no boundaries, no limits, no structure. Nor are we citizens that think it's okay for the governing body to be bad parents to somebody else's children with an agenda. We take great efforts to make sure that our children's daily needs would be provided for, and that would be a benefit for them in the short term and long. We are not here asking for government handouts nor giving the government permission to parent our children. If any right-minded parent that knows that any foreign substance would be a detrimental harm to their child's mental, physical, and spiritual growth, is it not our legal right in this state under Article 1, Section 3, which you are aware of?
Mr. Shrimp, you could wrap
Okay,
up.
that you would violate the dictates of my own conscience. In closing, I make sacrifices for my country, for my state, for my children. What sacrifices have you made for our children, for your state? Thank you.
Are there any questions?
Sorry.
Seeing none, thank you. Travis Grandin. Yeah,
Before I
think
do my
it is opposed.
testimony, I have a quick logistical question. I originally intended to come here simply in opposition to LD 798,
I see.
and it's a 3-minute testimony. But I also signed up and have a separate testimony for LD 987. Do you want me to do this one and then leave and come back and testify?
I know you can do both.
Do both, but it'll be over 3 minutes.
Let me see how long they are.
Well, the first one will probably just take me about 30 seconds. I can be quick.
All right.
But the other one will be 3 minutes.
30 seconds. Or 3 minutes.
Oh, sorry,
Okay.
30 seconds and 3 minutes.
All right, just go ahead. We'll see what happens here.
Do I need to sign in somewhere?
No.
Okay. Senator Millett, Representative Cornfield, and all other members of this committee, my name is Travis Grandin from Vassalboro, and I am here in support of LD 987. There have been many falsehoods swirling around the State House that medical doctors can just write a medical exemption if they feel that that is appropriate. However, that is not true. If you read the Maine immunization laws, a doctor can write a medical exemption only within a very narrow and restrictive set of rules. As Dora Ann Mills was quoted as saying last night on the news. We saw in California, after a similar law passed, doctors that wrote medical exemptions had complaints filed against them and were dragged in front of the medical licensing board. If you want more people to vaccinate, you don't force them, you restore their faith in the program. Maine's vaccination program is currently very broken, and we don't even know how broken because we don't track the vaccine injuries. This bill doesn't fix the vaccine program, but it is a great first step in restoring people's faith in the program. So, I didn't give you my opposition. I'll distribute that after, but Senator Roulette, Representative Cornfield, and all other members of this committee, my name is Travis Grandin from Vassalboro, and I'm here to oppose LD 798. When a bill is presented, the responsible thing to do is ask yourself if there's an actual problem warranting a legislative fix. I can tell you with absolute certainty that no such problem exists. In short, this bill is a solution in search of a problem. You will hear testimony proving that Maine's current vaccination program is achieving very high vaccination rates, and that a bill such as this could actually cause those rates to drop. While this bill will not fix any problems, it will create many new problems, and I will address only one: the profound financial impact on our entire state, vaccinated and unvaccinated alike. It has been argued that many of the exemptions are used just because parents are lazy and don't want to take the time to get their child immunized. That may be true in other states, but not in Maine. In the laws regarding immunization requirements, Section 3, subsection A, number 2, allows a parent to grant consent for the nurse or other public health official to get their child up to date. Laziness has been taken out of the equation. The approximately 4% of parents that use exemptions do so because they have sincere religious and/or philosophical objections to vaccinations and will not be compelled to vaccinate just because you pass the law. This will lead to financial devastation at every level. First, individual families will be impacted. Think about single-parent families and families that rely on 2 incomes. Many of these families will end up on public assistance because they had to quit their job to homeschool their children. Second, schools in their communities will be impacted. As you all know, Maine receives funding on a per-pupil rate that averages nearly $12,000 per student. Each school will lose that amount for every student that is kicked out of school if this bill passes. For example, Senator Carson, the Brunswick School District can expect to lose almost $900,000 if this bill passes. Representative Cornfield, the Bangor School District can expect to lose nearly $1.3 million. We all know that our schools run on a shoestring budget and cannot afford this bill. Finally, the state of Maine as a whole will be negatively impacted if this bill passes. It is a well-known joke that Maine's #1 export is highly educated young people. Those who utilize philosophical and religious exemptions are overwhelmingly young, highly educated parents. Do we really want to further ostracize this demographic of people at a time when trying hard to attract them to this state? You'll hear testimony from multiple people today explaining that they plan to move out of Maine if this passes, and for each of them, there are thousands more like them across the state. They have no desire to leave the state, but for people who felt compelled by principle to utilize an exemption, this bill leaves them no choice. They are highly educated people, many of whom own businesses. They own property, pay a lot in taxes, and provide jobs for others. The state of Maine cannot afford to lose these families. My wife and I hold multiple degrees. We own multiple properties, and we own a business that employs multiple people. We pay a lot in property tax, income tax, sales tax, and all the other numerous taxes in Maine.
Are you close?
I'm very close.
Okay.
Thank you for checking. If this bill passes, like thousands of others, we may have no choice but to leave the state that we grew up in and wanted to raise our children in. There's only 4 more pages. I'm just kidding. I'm just kidding. There's 3 lines. The bottom line is that this bill does not solve a problem, but it creates financial destruction at every level. Voting no on this bill is not saying you're anti-vaccination. A no vote on this bill is saying yes to the future prosperity of Maine. Thank you.
Thank you very much. Any questions? Thank you very much.
Thank you.
All right, Tony. Bush.
Good morning.
You'll have to tell me what your last name is.
Oh, Bashinsky.
Bashinsky.
It sounds like it's hard, but it's not. I actually have testimony for 987, but I'll just do 798. I didn't realize they'd be separate. So, good afternoon. I'm sorry.
Did you have stuff to give me?
I don't know. It's on my other sheet. I'm just here to say that I am in support of LD 798. I do believe that our doctors should have the right to maintain that autonomy for our children when it comes to medical exemptions if they do need it. Excuse me, I'm sorry, 987. 987. Support 987. I'm sorry. They're so close. I just think it's important for the doctor-patient relationship to be held to the standard that you would hope it would be if you had a child that needed some sort of medical exemption, and that you wouldn't have to go through Big Brother or any other government entity to be able to maintain that for your child so that they could attend school. And I will do my 798 later.
Okay.
That is all.
Thank you very much. Are there any questions?
Thank you.
Thank you. All right, Danielle. Grandin Stevens.
She'll be testifying later on 798. Try to keep
Okay.
things concise.
Will.
They didn't tell me about these people. They just brought it to me.
Okay.
We haven't called.
No, that's right. We haven't done neither for nor against, so we're going to move to neither for nor against. We have 4 people. James, Lyons. Weiler. Yeah, and then Suzanne Lafreniere or Lafrener, Samantha Warren, and Elizabeth, what do you think?
Moulton.
What do you think? Moulton. Please come and fill in the front row. Okay.
Thank you. My name is Dr. James Lyons Weiler. I come to you all the way from Pittsburgh, Pennsylvania. It's almost a 12-hour drive, and I'm very happy to be here. I think the problems that you're working on are very important. Dear Senator Millett, Representative Cornfield, members of the Committee on Education and Cultural Affairs, I have written testimony here which I'm going to hand in, but I want to speak more extemporaneously about this because I really have a lot of compassion for what I see you going through. First, I want to congratulate you on holding civil proceedings. This is very important in our society to do this. I'm serious. I've been traveling around the world at the behest of people who are exactly in your shoes, asking me to explain why they can't decide on this very issue. So I'm here to explain to you how vaccine science is done. Most vaccine safety studies are done with very short-term outcomes. They tend not to use, in fact, only one vaccine on the pediatric schedule was ever tested against an inert placebo. Usually, when we do drug studies, we have to test it against something that's not affecting the body. And instead, they use either an aluminum adjuvant or another vaccine. Okay? Now, my research made a very big shift when I started reading about vaccine safety studies. I've published over 56 peer-reviewed research. I've written 3 books, research studies. They're all peer-reviewed. And I've personally studied the pediatric dosing of aluminum in the current vaccine schedule. And part of the problem is there's acute chronic dose toxicity of aluminum that is not really well talked about. It's not amplified, certainly, that causes a serious problem for some people. Another part of the problem is that in the vaccine safety studies that are done after the short-term follow-up, maybe for a very short period of time, then they do what's called post-market surveillance. In that post-market surveillance, that's where epidemiology comes in. And I've recently done the math. For any adverse event that's real, but has less than a 1.15 increase in relative odds, epidemiology can't detect it. That means any adverse event, whether it's serious or not. Now, if you know anything about autism, I've read 2,000 studies on autism to find out what the biological mechanisms of autism might be. Any adverse event, whether it's serious or not, that's less than 1.15, could actually be happening in the vaccines, and caused by the vaccines. And epidemiology, the very gold standard study that the CDC treats as gold standard, can't detect it. And you can repeat the study, even with 500,000 patients, and you won't detect it. And so I come to you neither for nor against, because I don't think it can be decided that one could mandate a medical procedure when I feel that the vaccine safety science has not been done to the gold standard, which is the randomized prospective clinical trial. I represent the Institute for Pure and Applied Knowledge. It's a not-for-profit, and we're doing the Vaxxed-on-Vax study that everybody who's got a vaccine-injured child wants to have done. I thank you for your time, and I really have a lot of compassion for what you're about to undertake.
Thank you very much. Any questions?
I just want to say something.
All right, go ahead.
I just want to thank you. I actually had to step out of the testimony to record a piece with Speaker Gideon with NPR about civility in politics.
Yes.
So I appreciate your comments on the efforts here to do this in a civil way. It sounds like you've been around the country and seen it debated quite a bit.
The Allegheny County Board of Health actually threatened to have me arrested for asking a point of order on whether or not the public was able to speak to a question, so I appreciate that. I really honestly do appreciate this civil proceeding, so congratulations. Thank you.
Thank you very much.
What can I do? Oh, another question. Sorry.
Representative Sampson?
Thank you. Thank you for coming. Do you have more materials to support this? Can you send us what you just talked about?
Yes, I can.
Because, is that in here? Because I was over there working with a clock.
I will be happy to send you plenty of material on everything that backs up everything that I said, yes.
Thank you.
Thank you.
All right, thank you very much. Samantha Warren, is that right?
Yep, Suzanne, sorry.
I beg your pardon.
Oh, it's okay, no problem.
Suzanne.
Good afternoon, Representative Cornfield and other members of the committee. My name is Suzanne Ross. I represent the Roman Catholic Diocese of Portland. The Diocese of Portland is comprised of the Catholic Church in Maine. It's 141 churches organized into 55 parishes. We have about 297,000 Catholics in the state of Maine. The reason why I come to this particular bill, neither for nor against, is because of a balancing of interests. I'm not going to read you my testimony, but in general, the Vatican and Catholics believe that parents have a moral obligation to vaccinate. Having said that, there are some concerns that I have about the bill. My number one concern would be that the way the bill is written, it seems like it is overbroad. The way the bill is written, what if the state required vaccinations for specific vaccines at an absurdly early age? The example that I'm giving in my testimony is HPV at age 8. Something like that, that would definitely concern me. The way I look at a bill, I always am trying to also look at how it might affect the poor. If vaccines are required and if this bill as written would go through as law, a lot of socioeconomically disadvantaged parents would not be allowed their children to be educated in our public schools. That's not a real option. Homeschooling is not a true option for a lot of parents in the state of Maine. And so I always look at bills through 3 lenses: human life and dignity, how this will affect the poor, and the common good. And this affects all 3. And so you can read my testimony in front of you, but that's why I came to it neither for nor against.
All right, thank you very much.
Thank you.
Oh, wait a minute, I'm sorry. I beg your pardon. Representative Drinkwater.
Thank you for coming and presenting the view, neither for nor against. Catholic education, very good. Would this affect your
It would. I did the
kids?
research and I talked to legal counsel for our Catholic schools, and it would. The way the Department of Education rules are written and HHS rules are written, it would affect our Catholic schools. Something now that I'm thinking about it, that I just also want to highlight to you is conscience exemptions. I have a small but I think real concern that if just the philosophical exemption was extinguished, that all of a sudden in one of the most secular states in the nation, we would already all of a sudden have a lot of religious people with religious exemptions. Religious liberty is obviously one of my number one concerns here at the State House, and I think that if it were misused, and my assumption is that it would probably be so, misused, that really sincerely held religious beliefs and the conscience exemptions, not just in vaccines, but in other areas of the law, might be saturated and misused and not be able to be used in a real, authentically religious belief manner. So I have some concerns about just extinguishing one in favor of the other.
Representative Rodnicki.
Thank you, Madam Chair. Do you have any numbers as to the amount in the Catholic schools, the amount of children that would actually affect?
I don't know why that goes off. Could you put the microphone on for her?
We should learn how to do that ourselves. I do not have those numbers, but I can get them to you for the work session. I do know that that the religious exemption and the philosophical exemption is used in all of our schools. So, but I don't know the statistics yet. I will get that to you before work session.
All right, thank you very much.
Thank you.
Samantha Warren.
Good afternoon. Am I working? You're working. Okay. Woohoo. Good afternoon, Senator Millett, Representative Cornfield, and distinguished members of the Education and Cultural Affairs Committee. As you well know, my name is Sam Warren, and I am the Director of Government and Community Relations for Maine's public university system, and we testify today neither for nor against LD 798. I would just say that of all the bills I've worked on for the university, with almost 30,000 students, 5,000 employees, this is the one that has generated the most conversation on our campuses, and that is because while we support vaccination on our campuses, as we work to raise educational and workforce attainment, we have serious concerns about the barriers that this bill could create to the very Mainers who most would benefit from a post-secondary education. As you may know, and perhaps you've seen it, and if not, I'll get it to you for the work session, but all of the post-secondary schools in the state, much like the K-12 schools who have gone before me, need to submit to the Department of Health and Human Services our vaccination rates. Not surprisingly, while nearly all of the students at our predominantly residential and kind of traditional campuses in Farmington, Fort Kent, Orono, and Presque Isle have provided proof that the majority of their students have met immunization requirements, there is a high usage of the currently allowable philosophical exemption at our heavy commuter campuses in Augusta, Machias, and southern Maine. For example, at UMA, which you heard about so much yesterday in the Appropriations Committee, 60% of our students are over the age of 25, and most are accessing their courses online and through a regional center. At that campus, nearly 1/4 of students are using existing philosophical opposition to a vaccination. While certainly some of these students request their exemption thoughtfully and intentionally, the university believes that most are actually without convenient access to immunization or to their immunization records at the time they register. These students, as you heard and met yesterday, are low income, they lack affordable access to preventative health care, and they are time and place bound by the realities of rural geography and family and work commitments. In most cases, they are the first in their families to aspire to, let alone attend college, and they are enrolling in our courses literally days or even hours before they commence. So telling these students that they would suddenly need to find decades-old vaccination records could be a major barrier to them. So as this bill moves forward, we would ask that the Departments of Health and Human Services and Education be required to convene some sort of stakeholder group with this population in mind, because we want to be compliant, but we also need to get access for these folks. Among the things that this stakeholder group may want to consider, currently enrolled students be grandfathered so that they can persist to completion without interruption, that the Maine immunization program be expanded so that its low or no cost vaccinations can be provided not just to those under 18, as is currently the case, but those over 18, our students, and that we would work with the Maine CDC and other public health partners to stand up vaccination clinics in every Maine county so that we can address this rural population. As our state makes meaningful progress, and I'll wrap up, towards the goal that by 2025, 60% of all Mainers will possess a post-secondary degree or credential, we look forward to partnering with you all and the CDC and other public health partners to ensure implementation of this requirement while balancing the sometimes competing commitments of student health and educational access. And I'm happy to answer any questions.
Are there any questions, Ms. Warren?
Sorry.
Representative Rudnicki.
Curious, when you said that, you said nearly 25% of the Augusta students are on philosophical exemptions?
Yes.
Now, do you believe, and I think I heard you say this, but I just want to double check, do you believe that this would adversely affect the enrollment in our university system?
That is absolutely the reason I'm here today, neither for nor against and not in support of this bill. So I'll just really quickly go over the numbers and we can provide them to follow up. But at UMA, 3,000 students, round numbers, are required to be to meet immunization requirements. I talked a lot about online students, but many students are taking a blended course where it's some online and some in person. So they do have to meet these requirements. Solely online students do not. So 3,000 students at UMA are required to meet these requirements. Around 2,200 actually do. 700, again, round numbers, use philosophical exemption. 18 use the religious exemption, and 131 students at this time are not in compliance. So what we do is, if you come to register for a course, you do not have those records or you are not immunized, we put a hold so that you can participate in courses that semester, but you cannot re-enroll unless you either provide an exemption or the documentation. At the University of Southern Maine, of the 8,000 or so total students, about 7,200 have provided proof of vaccination. 15 have sought religious exemption. Over 400 have sought philosophical exemption. Over 200 are not compliant, and 83 students at USM are not required to be compliant because they were born prior to 1956.
Thank you very much.
That's me.
Thank you very much. Yeah, Representative McCray. Aren't you going to say?
So if I enrolled, I'm an 18-year-old out of high school, enrolled and got accepted at USM, let's say. I get down there and you say, I need your immunization records. Is it fair to say that I might very well say, I philosophically disagree with that, and then I don't have to provide anything?
That is correct.
Okay,
So there's a form on the website, and I can provide you that documentation, but basically, on the page that outlines the immunization requirements, there is language that says if you have a moral or religious or a medical exemption, here's how to indicate that to us. And certainly, we have no way of truthing that. I will say in our nursing and teacher preparation programs, traditionally those students are not allowed to take exemptions for reasons you can appreciate. However, those students can approach the chairs or the head of the department, and many students do so very thoughtfully and intentionally in those professions.
Thank you very much.
Any other questions for Ms. Warren?
Thank you.
Okay, so we've informed that we have 2 pediatric specialists who can only be away for less than 30 minutes, and have asked to be able to testify. So we're going to go a little bit out of order. We're on call, yes. And so we're going to go a little out of order, and I'd like to invite Dr. Stanley Chaliff to please come up.
Who do I submit the testimony at the end? Okay. Good afternoon, Senator Mallett and Representative Cornfield, and the members of the Joint Standing Committee on Education and Cultural Services. My name is Stanley Chaliff, and I'm a resident of Portland, Maine. I always have to say Maine, 'cause never mind. I'm here to testify in support of LD 798 as both a parent of a 4- and 7-year-old boys and a pediatric oncologist with 14 years of experience in practice, and 11 of those here at Maine Children's Cancer Program. As a pediatrician, I have seen firsthand some of the effects that can happen when children are not immunized. As just one example, in residency on repeated occasions, I took care of a young man who was neurodevastated by a preventable disease, measles. He was dependent on a breathing tube and was nonverbal and routinely had to be admitted to the hospital for periodic lung infections. To turn to what I do now, as a pediatric oncologist, I care for some of the most vulnerable and medically at-risk patients in the state. These are patients who both cannot get immunizations during their therapy for multiple reasons. They're not likely to be effective because of their altered immune state, and at risk for getting disease even from normally harmless versions of the virus in some of the vaccines, like MMR. And if they get exposed, these kids are at the highest risk to have the worst manifestations of, again, these preventable diseases. To put perspective on this issue, over 80% of all children with cancer will be cured today with current therapies. However, getting them to the place that they will be cured likely involves significant chemotherapy that dramatically weakens their immune systems. During treatment, we encourage children to maintain as normal a life as possible, to get to school and socialize, because the treatments for childhood cancers can take up to 3 years or longer. If they are to get what should be preventable infections, they are likely to get a much more severe form due to their immune suppression, putting them at risk for lifelong complications or even death. At this time, families are scared to send their children to school, and often this includes siblings because they worry about what illnesses could come back into the house. And much of what they are worried about is almost completely avoidable if we have a thoughtful approach to who can be exempted from getting immunizations. One last thing I want to say. I have many families who wanted to come and testify and bring their children to this meeting, but they knew they could not risk exposing their children, so they are silenced, and I have to be their voice. Thank you for the opportunity to share my positions on this important bill with you today, and I'm happy to answer any questions you might have.
Thank you very much, Doctor. Are there any questions? Thank you for being here today, and thank you for your work.